Well, welcome everyone to Real Balance Global Wellness Services free monthly webinars. I'm your host, Dr. Mike Orlowski, and want to let you know that our free monthly webinars are archived at realbalance.com. Just go to the wellness resource section. And if you're one of our students or alumni, you can go to your coach center where all of the free monthly webinars are archived as well. So Real Balance Global Wellness Services is a premier provider of health and wellness coach training. We are fully approved for the permanent phase of the National Board for Health and Wellness Coaching and by the International Coach Federation, not just for continuing ed, but for approved coach-specific training hours. We've trained over 10,000 health and wellness coaches all around the world. So please check us out. Now, the way this works is you're all muted upon entry, and you have a Q&A function that will help with discussion. So feel free at any time to put items in there that we can discuss together, things that we can check out and be aware of, and integrate, into the program itself. And of course, I'll be spending the last 5 or 10 minutes, probably, hopefully closer to 10, dealing with your questions and your comments and ideas about something that we're all concerned about, and that is what's going on in these pandemic times, and how can empathy and connection be a vital part of making this better for everyone. Now, I do want to let you know that archived already is a free monthly webinar that we did a few months ago. That's an hour long with Doctors James and Janice Prochaska and Pat Williams, Dr. Pat Williams. We did that really to earlier in this whole pandemic experience to really get across an idea that we're going to be talking more about today. And that's this combination of helping other people and also self-care in the middle of it. So please check that out. CEU's credits are available for that. So what are we talking about here? Well, this is such an ironic thing because it's a time when we need connection more than ever, right when connection is harder than ever to get. So what do we do about that? And how can we work with it? The thing about it is we can all relate. We're all going through this together. Empathy is often the experience where you've got a client that's going through something really difficult and you've never gone through that, not that exact experience, but you can relate because you have the human experience of feeling what they're feeling. You felt sad, rejected, depressed, frustrated, isolated, angry, whatever. You felt those feelings too. So you connect on that level and you can convey empathic understanding. Now, here, I'm kind of wondering if we are empathizing enough, because it might be easy to get the mindset or the point of view, hey, well, we're all going through this. What's the big deal? Everybody's frustrated. Everybody's feeling lonely. Everybody's feeling disconnected. So why do we have to say anything? Well, maybe we need to say something, maybe more than ever. So part of this is for our clients. And remember, part of this is for ourselves. We're all under unprecedented stress. And right now, we've got, stress coming from so many different angles. We've had so many wildfires throughout the Western United States. Here in Colorado, we've got them right, right over the hill here from me. Fortunately, we got some snow recently. But on top of that, we're going through an extremely stressful time with the election this year. We're also, of course, continually trying to adjust to the changing landscape of the current conditions with the pandemic in our area. So all of that's happening at once. We've got people working at home that have never worked at home before. We've got people trying to juggle things they've never had to juggle before, like school children in the house while they're trying to work, on and on and on. So We're seeing reports, from our clients of more stress, depression, and anxiety. Mental health professionals are really concerned about what's going on. And, we all know that we get so many of our needs met interpersonally. There's so many needs that can only be met that way. And don't forget, if we take a look at the recent, census work, even 10 years ago, we've got more individual, single, solo, individual households than we do households with mom and dad and the kids all together in it. Yeah. So a lot of people on their own, not just in a household where at least they're quarantined with other people. Also, don't forget about our own end of it here. Compassion fatigue. Putting out all this, compassion over and over again with our clients. Wears on you. Also, secondary trauma. We hear about kind of this, it's almost like a chronic level at a certain lower level. It's not like, when the World Trade Center went down and, my son was that close to being in it. I experienced secondary trauma from that, just from being so worried and upset until I knew he was safe. It's not like that big event type thing. This is a long drawn out process. Then there's the trauma, of course, of losing loved ones. We've got so many deaths now, and many of our clients and many of us have people in our own families and friendship circles. So, empathic understanding. We need it more than ever. And we are just making this stuff up as we go along. This is all new to everybody. I don't think there's many of us that have been through a pandemic before, maybe there's a few people hanging around from the 1918 Spanish flu, but yeah, this is really unprecedented. And we need to feel heard and understood. We do as coaches, as people, just like our clients. And also, we need to have our experience acknowledged. Our clients do as well. I'm going to say everything here, meaning you and our clients. All right. And we know that when we get that experience acknowledged, it really helps, to feel heard, to feel understood. I mean, it's huge. And to have our feelings validated, that it's okay to feel the way we feel. We don't have to just maintain this stiff upper lip, this courageous, we're going to go out there and, make the best of this anyway. Yeah, we have to have that attitude. But, I think what enables us to go out the door and do that even better is when we can let down and let somebody know just how upsetting it all is. When we can say it and feel like someone's hearing it and they're receiving it without judgment. They're not giving this, don't feel the way you're feeling, feel the way I want you to feel kind of message. I mean, that's really, really important. Something that, it's also conveying, and this is so important for everybody, to know that you're not alone about this. I mean, we kind of know that. I mean, you look around, you watch the news, everybody's going through it. But it's good to know you're not the only one that feels this way. Now, if any of you have been following my work for a long time, you've heard me talk about this acronym I made up called FAVE. First, acknowledge your client's experience. And maybe acknowledge your own experience. Maybe acknowledge it to yourself, how real it is. And then validate our client's feelings. That it's okay for them to feel the way they feel. And then empathize. Say something that is empathic, that comes across in a way that helps that person feel like, okay, here's somebody else that really gets it, that really gets what I'm going through. It's way too easy to start getting into strategic thinking and solution finding. It's that old, well, geez, if we can make the situation better, then the person won't have to feel this way and we're doing good now. The reality is a lot of times, there's nothing we can say that makes anything better. That's one of the things you get when you watch that famous Brene Brown video, right? So the empathic understanding is huge. And this really is truly the essence of a coaching mindset. So how do we do this? Well, if we were able to sit there and reach out and put our hand on that person's shoulder like this, that'd be great. However, social distancing, my arms aren't 6 foot long, and neither are yours, of course. So we've got to be able to put it into words. Yes, it's the look in the eye. And maybe we can still get that across here on Zoom, We can still do that perhaps. Whoops, sorry about that. But we've got to be able to say it. Say, look, we're just on a phone call. How do you do that? The look in the eye isn't there. So what are some words we can use? I'm not going to get into a big, lecture here on empathic skills, but we've got to be able to use terms like, and phrases like, sounds like, wow, sounds like that's just been so hard for you to have the kids at home and trying to work at the same time. It must be so difficult. That must be. And lots of times we put them together just like that. Sounds like, that must be, finding ways that adapt to what your client's saying, what's important for them, what they're really trying to convey. And in a way that shows understanding and empathy. We can also put it in question form. Wow, what's it like to be in chronic pain every day? What's it like to be living alone all this time, during this whole pandemic? What's that been like for you? And again, the way we say it is more important than the words. Every bit of research on nonverbal communication that's ever been done always says that it's the nonverbals, the vocal, the nonverbals that get across the message much more than the content. It isn't just the words that we could transcribe. It's how we say it. And that's got to be sincere. It's got to be genuine. And if you're not feeling it, get in touch with how you're holding yourself back. Because you hear what's going on for people, and how can you not feel it? If you're not feeling it, are you kind of numbing out? We're going to talk about that in just a moment. You can also say something that's just terrifically direct. I mean, one of the most empathic things you can say sometimes is, that really sucks, doesn't it? Just that direct. People appreciate that. So, talking about how we're holding ourselves back, there's a really great book here called The Empathy Effect. And this MD here, Helen Rice, I'm not sure, my apologies to her if I'm not getting it right. And also, I guess, a secondary writer there, Liz Neparent. They did a lot of research around medical doctors and how at times they hold themselves back from expressing empathy and other times do, and what a difference it makes. I mean, when you're on the front lines, you have to kind of have this clinical separation, distancing in order to deal with, whatever's bleeding, so to speak. And what's unfortunate is that sometimes people will kind of cloister themselves with a protective mechanism. I mean, it's kind of natural, to kind of pull away rather than pull together. I mean, to kind of put your hand up and say, well, I don't really want to look at all that, because others are in pain. But yet we are literally wired to empathize. This is part of the neuroscience that Helen Rice is talking about here. What's really fascinating is that when we witness pain, when we see someone in pain, the pain pathways in our own brains light up. They get activated. Okay, so there's empathy personified. There's a scientific definition of empathy if you ever wanted one. If you had to have that real hardcore definition instead of the touchy-feely one that we all totally accept as completely real. Whoops, my apologies there. Here we go. So what Reese's research found was that this emotional distancing, when we do that, it actually makes our patients, or in our case, our clients, distrustful. They found with the doctors here, even disgruntled and less cooperative. And it makes lonelier, less effective, and more burned out helpers. So this natural tendency to protect ourselves seems like a good idea at first. It's like, I'll never forget when I was an undergrad, one of our psychology professors said, don't let your patients, your clients get to you, on that emotional level. Have that therapeutic distance. I think what makes really great coaches work is when they can have compassionate detachment. And compassionate detachment means I am right in there with you. That compassion is being expressed, and I am right here beside you, side by side, shoulder to shoulder with you in this. And yet, I have this detachment that realizes your burden is your burden, and I cannot carry it for you. If I take it home with me, it does you no good. You don't even know it. And it burdens me, and it burns me out. So how can I do that? Take a look at what Pema Chodron, Chodron, I believe it is, has written about compassionate detachment, and also Kristen Neff, Neff. So compassionate detachment is huge, but don't let it hold you back from empathy. Hopefully you've all seen the Brene Brown video, the great one with the little cartoons here. And one of the things excuse me, frustrating. One of the things, can I get some empathy for my catch in my throat today? That's pretty small stuff, I know. Empathy. Brene Brown's video is excellent, and people, watch it all the time, use it in schools. She speaks very fast, so it might be easy to miss some of her key points. Certainly, we hear her when she says, empathy fuels connection. It does. That allows that person to feel connected. And they don't want sympathy. Nobody wants to feel like, oh, poor you. And when it comes to this whole pandemic, yes, I think there's a place for sympathy when someone's loved one has died because of this. Sure, that's an expression of grief. That's an expression of, we're sorry to hear that. And, that's genuine. But beyond that, it's the empathy for their experience, for what they're going through. And there's these 4 aspects that Brene Brown outlines, says them very fast, so it's easy to miss them, but they're really important. Perspective taking on that other person's point of view, staying out of judgment. All the shoulds and, this person shouldn't feel this way, they should feel this way. Why are they reacting this way? Stay out of it. Doesn't do anybody any good. It's also recognize the emotion that's going on for the person. What are they feeling? Are they feeling angry? Just really frustrated? It's kind of hard to get angry at a virus, but maybe it's angry at the system that hasn't responded well, or maybe, your grandmother died in a nursing home that wasn't properly taken care of. Maybe it's sadness, maybe it's, who knows, but recognize it and communicate that. That's number 4 and the big one. You got to be able to put it into words. What really makes empathy work, what really puts legs under it, you might say, is when we can say it. The other thing that Brene Brown gets at that I think helps us understand why sometimes we hold back. I love it when she says, it's a vulnerable choice because in order to do it, you got to connect with something in yourself that knows that feeling, that uncomfortable feeling that that other person's experiencing. Hmm. You ready, willing, and able to do that? Hopefully. And then she really gets across the argument for connection and this point that, you know, just saying this stuff doesn't make it better. There's nothing you can come up with, where you can make it better. But it's something that does make it better is feeling not alone, feeling that connection. Connection is the currency of wellness. That's something Jack Travis, one of the founders of the whole wellness field, said a long time ago. And we know we've got tons of data that shows that social isolation is a huge health risk and is correlated with everything from heart disease to cancer to you name it, greater incidence of it. So if so many of our needs can only be met interpersonally, what are we going to do here? And one of the problems with all this is not a short-term situation. You got to be in this for the long run. We know that the way through crisis is when we have enough resilience to hang in there with it, to keep on keeping on. And it's through connection and reaching out and getting support that makes this work. So one of the problems that we see all the time, and I've got to ask you, we talk about social distancing. It really needs to be physical distancing, not social distancing. We need to be socially connected more than ever. But how do we do that in these times? A lot of people complain about being zoomed out, right? It's kind of tiresome to be in these, big physically separated situations. We're dealing with something we've never dealt with before, with the new normal. So how do we help our clients and ourselves through this? It's about new strategies. And what I believe is that instead of just getting into all this intellectual thinking about it right away, if we do the empathic work, if we do the emotional work first, we can kind of clear the way. If we can help someone talk about their fears, if they can unburden that emotional load, I think their thinking becomes more expansive and more effective strategically. So then in the coaching process, you can get into strategic thinking. Strategic thinking and problem solving and coaching is a lot of fun, really is. You come up with all kinds of new creative ideas. And you can do that around creating greater connection with other people. But to clear the way for it, don't hold back on the empathy. Don't hold back on the emotional processing first. Then start generating some safe strategies. And to me, it's kind of this three-part process here. Explore with your client their situation. What do they want to do? How could they, what do they want to do to connect with other people? Maybe they get that great desire to go have a glass of wine or some other kind of wellness beverage or whatever with friends or have a dinner together. Yet you've got to kind of filter it through what I love to call functional paranoia. Okay? This is when paranoia has a real function to it. How do you filter it through? Like, what questions do you ask yourself before dining out? How do you evaluate the situation? What are the guidelines that the World Health Organization and places like that tell us we've got to really be conscious about? And then we come up with new strategies to make it happen. Maybe we can get together, ourselves and our roommate or ourselves and our, someone in our family or whatever can be on one side of the table and a couple of friends that, are safe together can be on the other side. Maybe, it's wearing masks. Maybe it's doing things that we're not used to doing, but it still allows us to connect. We can still have that connection, even though we can't, you know, do the kind of hug we'd like to hug. I mean, how many times today, you know, in our lives today, do we have that virtual hug thing going on? Well, hey, at least we're close enough to see each other and kind of feel it. So it is about helping your client to do this and building connection for you. This is not to be forgotten. One of the things is reach out to other coaches. You know, what are they going through in the middle of all this? Get into conversations with your colleagues. And to find colleagues, you know, connect with interest groups on Facebook, on LinkedIn. It's about creating community and getting the support that we all need. And here's some great resources for you. There's a article that I saw online published by the Greater Good magazine, and it's Why the World Needs an Empathy Revolution. Really great article. Just go ahead and check that out. Also, take a look here at the blog that I wrote, Social Distancing, Not Social Isolation. That's hard to say. Coaching for Connectedness in the Age of COVID-19. Check that out on my blog site. And Real Balance, part of our, you know, mission is craft, community, and cause. And the community part is huge. And we've got a Real Balance Facebook group. We've got a LinkedIn group. So check all of that out. And I've got a Q&A here saying, please send these links to us. Yeah, we'll do that. We'll do that. Thank you. So that's the segue right there into, let's get a few questions. I see I've run us up all the way to darn near no time left, but let's get a few anyway on your comments and ideas about this. I just really wanted to convey this message to, you know, all the people that participate in our monthly webinars, because, you know, this is a time when we've got to remember it isn't just about, like I said, strategic thinking. I'm hoping that we can clear the way to get to strategic thinking by having more connection. Oh, in the chat function, we've got a few things here. From Mary Lynn, she says, empathic comments can be the difference between a successful and unsuccessful session with someone who's really struggling right now. Empathetic, empathic means you can read minds and feelings. It kind of seems like it. And thank you for addressing this. Yeah, you know, I think, again, it's how do we help our clients, but also how do we help ourselves? And from Shaughnessy, how do you build empathy when folks want to jump to concrete steps they want to avoid? You know, jumping to a solution is really tempting. And a good way to back them up is to say, well, tell me, yeah, let's do that. Let's do that. That's really important. But before we do that, tell me a little more about your situation. And almost inevitably, when you hear more of the story, the person will get into what's going on for them, what's really happening. And then you can empathize. And Kathy says, this is so timely as my community and clients are still grieving together from the Alameda fire. Yeah, I mean, golly, everything at once here, right? And from Marilyn Massey, I think some people struggle in talking about feelings and hearing others express difficult feelings, particularly when it triggers vulnerability. Coaches have to be bold and brave. Yes, they do. It is courageous coaching, you know, and if there was ever a time for courageous coaching, it's really now. You mentioned not telling our clients how they should feel. How do you handle them shoulding on themselves? Example, I shouldn't feel this way. Yeah, you know, again, you want to be empathic with the way they're giving themselves a hard time. And, to be able to say something like, boy, it'd be great to not have those feelings, wouldn't it? I mean, they, aren't they real for you? Just try that sometime. Give an example of managing compassionate detachment. You know, um, I had to do an awful lot of that as a therapist because as a therapist, you go wherever your client needs to go. And I worked with a lot of victims of abuse and tragedy and trauma and you name it, like all therapists end up doing. And I realized, that there were times when my own feelings would get triggered. I'd be so frustrated hearing how someone had been treated by someone else. And you can't do anything about it. You can't go can't go back to that person's home, grab a hold of somebody and say, hey, quit doing what you're doing. Even though you have that feeling. And I realized, that I can't do that for them. And I've got to be there to help them unload what they need to unload, not that they unload it on me. I guess the best story is I had a client that was upset because she felt like she was doing that to me. And I said, no, 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 it doesn't work that way. It's kind of like you and I have this great big wheelbarrow full of all the crap that you've been talking about. And we take it down to the end of this big long pier and we dump it together. I don't say, okay, wait a minute, let me go down underneath where you're dumping it, and then you go ahead and dump it. No, we're up here together and we're dumping it together. So, unfortunately, we've run out of time, and I really appreciate everyone's attendance here today. Please stay in touch. We're going to be, of course, offering more classes here in November, and please check that out and share it with others. We, like I said, we are fully approved by the National Board for Health and Wellness Coaching in its permanent phase. And we're going to be doing our next free monthly webinar on November 20th. Keep in touch with our newsletter and take a look at our website. We'll be posting the topic there soon. So thank you, everybody. I can't really keep you longer. Please stay in touch. Give us a call if you have any coaching questions or ideas or needs. We really appreciate it. And all the best to all of you. Thank you very much. Bye-bye now.